So we have a problem when we are treating these areas of resorption with recurrence. And it really comes down to our lack of ability to really predictably, in some cases, eliminate the etiology. If there's resorption happening and the cells responsible for it are now getting blood supply from a few different areas, like they are in this extracted tooth, if we were to place a restoration in the cervical area here and think that we had done our job, there would still be areas where blood supply was coming into the deep areas of the lesion that was actively resorbing the root and potentially allow it to propagate even after we had taken care of this area up here. And it's hard to know when we're going to encounter this type of multiple areas of alternate blood supply and resorption. So I got talked into doing this case a while back, and this was actually kind of in the infancy when we were working on resorption. This was maybe 20 years ago now. And I really didn't want to do it because I didn't think it looked like a good case to try. And the periodontist assured me that he could eliminate the etiology and get a nice restoration in there, and he wanted me to do the root canal first. So I did the root canal, and then she left. She had the resorption repair done at the periodontist, and then she came back 4 years later saying your root canal's not working out. And she's right. The root canal is not working out because there has been this horrific recurrence of the resorption on this tooth. And the other thing that makes me angry about this that I don't do anymore is notice there was no final restoration here. So she saved a little money on that because now this tooth is going to come out. Again, because we really didn't effectively eliminate the etiology of the resorption. And with resorption, even when it's over, it's not over because these areas tend to be bad sites for implants too. And there can be little bits and pieces of resorbed roots that could sometimes lead to failure of the implant. So developing the site after a resorbed tooth is removed requires more diligence and more time. And everyone wants the immediate implant placement these days, which is a wonderful service. And that's the main downside, right, of implant dentistry is it takes a while, one of them. But this is what it looks like. The tooth comes out, and then Dr. Karras here has grafted the area and carefully kind of rebuilt that. And it's also difficult to get a tooth out and still maintain the buccal plate because there usually is some sort of ankylosis where the resorption is happening too. So this is nice handling of a resorptive case that was not going to succeed. And a lot of them do wind up this way.